My name is Katie Brumfield. I am the manager of career services at the Colorado School of Public Health. And today we are talking with Ashley. Ashley is an alum of our program, and we get to learn all about your career path and what you're currently doing in public health. Hi, Ashley.
Hi, how are you?
I'm great. How are you?
I'm good, thank you.
Happy Friday.
Yes.
Oh, could you start us off by introducing yourself, your current job title, where you're working, any disclaimer you might need to give, the year you graduated, and your
Okay.
concentration?
Okay.
I know.
Let me know if I forget any of those
I
things.
will.
Hi everyone watching this. I'm Ashley Nix, she, her pronouns. I currently work for the National Traffic Safety and Highway Administration.
Oh,
NHTSA is the
oh,
acronym.
yeah. We love
So
our
that is
acronyms in public.
Yes, lots of acronyms. So NHTSA, you can Google it because
Yeah.
I didn't know it existed when I was in school. It's a federal organization that works on traffic safety and highway safety. I just started there a few months ago. It is, I don't know if the date will be posted with this, but it's January 2025. I started in October
Yeah.
2024. So pretty new over there. And previously, I was with the Colorado Department of Public Health and Environment
Nice.
for over 5.5 years. So that has been my public health career thus far. I Just to give a brief disclaimer, these are just my experiences personally. Anything I talk about, is not representative of the health department of the state or of NHTSA. Just my personal experiences. So I graduated from Colorado School of Public Health back in 2018, I think. Oh my gosh, if I can remember. Yes, 2018. And before that, I had my undergrad career at CU Boulder.
Oh,
So I've
nice.
been in Colorado
Oh.
forever. I'm from here. I was born here, grew up here. Um,
Native. Nice.
Yes. So I've moved around the whole state and I've, gone to different places around the state and love the state. So I love the state so much. I wanted to be part of the state health system. So yeah, that is kind of where I've come from. Let's see, my
Yeah.
concentration was so Master of Public Health, obviously.
Yeah.
Concentration was community and behavioral health slash global health,
Nice.
if
Okay, the
that's
global
still,
track. Yeah.
yes, global track. Because originally my dream job was to work for like the WHO, um, the World Health Organization. Sorry, try to say the
Yeah.
acronyms for those who don't know, or the CDC. Those were kind of my big dream job gigs. So I always knew I wanted to go into some big organization, either governmental, or something that was just well established. I had come from nonprofit experience throughout college and I loved it so much, but it was a lot of work. Not saying that, it's not a lot of work in the government, but it's different work for sure.
Yeah, 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 definitely.
Yeah.
And
Did I
what's
cover
your,
everything?
well, I think the only thing we're missing is what's your current job title?
Oh, yes. Sorry. So I'm a regional program manager at NHTSA. NHTSA has, I believe, 10 different regions across the nation with basically like headquarter housed in different states. So
Hmm.
I'm lucky that one of the headquarters is here in Colorado. It's in Lakewood. Um, and so that is Region 8, and each region has a couple of different states that they are basically the
Yeah.
managers of. So Region 8 includes Colorado, Wyoming, Nevada, Utah, South Dakota, and North Dakota. I think
Wow.
that's all of them. So I help to manage the Highway Safety Office funds that come from NHTSA that go to every state's Department of Transportation, specifically their highway safety offices, which do a lot of behavioral programming in traffic safety. So your young driver safety, your child passenger safety, impaired driving prevention, things like that. And then law enforcement, of course, is kind of looped into that. But
Okay.
basically, I help manage the funds from the federal government down to the state governments, and then help to help states, make sure that they're doing the work that they want to do and that it's effective.
That's super cool. So yeah, you're kind of like the liaison between those and wow, that is so cool.
Yeah.
So do you have to do a lot of like budget tracking and like
Um,
fiscal reporting type stuff?
yes and no. So
Yeah.
we do, at least of the way, I don't know that every regional office operates the same way, but ours is kind of split into like a compliance fiscal track
Hmm.
and a program track.
Oh,
And
okay.
so I am part of the program track.
Nice.
And I, with my experience at the Colorado Department of Public Health, which I'll refer to as CDPHE because it's a mouthful.
Mhm.
So at CDPHE, I was also part of the motor vehicle safety world. So I
Oh,
was hired as a program coordinator for the state's highway safety office programs. If it took me a long time to wrap my head around how all of this works. And when I was a student, I did not know that this existed. I never even thought about traffic safety as a public health issue. When you're learning about public health and you're in school, I think a lot of the hot topics come up with, what we kind of think directly related to health, like your AIDS prevention, your teen pregnancy, your nutrition, tobacco prevention, things like that. So, motor vehicle safety was new to me. Um, and I would say I put all of that under the umbrella of violence and injury prevention. So that's that my title is a regional program manager at a traffic safety administration organization, but I consider myself a violence and injury prevention public health professional. That's how I would talk about it, and
that
that's how I
makes
think
sense.
about it. So
Yeah.
yes, kind of a liaison between the federal government and the states, with funds, with programs, help connect them with resources, help answer questions regarding federal, do's and don'ts, what they can and can't spend money on. So a little bit of everything. I think you'll
Awesome.
learn in public health you wear a lot of hats, and that has been true the whole time.
Yeah, yeah, exactly. Sounds like a lot of communications.
Yes, lots of communication. So luckily, I'm thankful that I'm not like part of the communications team. I don't consider that like a strong skill set of mine. So I don't do like media and that
Yeah.
sort of stuff. But I do help, advise on, or I have helped advise on, media topics in the past, or how to talk about different things. When I was at the state level, I part of my focus was on young driver safety. So, youth, working with youth, talking to youth, amplifying youth voices. So, a lot of skills were built kind of around that youth perspective. So, everything from facilitating in person and virtual meetings with young people, even relationship building is a huge skill. And I've seen that be requested in job fields more and more, because I think as things change, and as initiatives kind of shift and shape over time, I think there's been a really big shift in realizing how important relationship building really is to do sort of community level behavioral health injury prevention. And relationship building takes a long time, and it's not a one size fits all approach. So people are looking for those skills. They're highly, highly valuable. I think when I was in school, a lot of these skills were talked about as soft skills.
Mhm.
Um, and that's fine if that's your terminology, but I wouldn't want that to deter anyone from, beefing up those skills or talking up those skills about themselves. If that's your jam, and you are, good at it and you enjoy relationship building, communicating with others, that's like my meat and potatoes of what I do in public health. I love meeting people. I love hearing their stories. And I'm super fortunate that I've been able to turn that into a career.
Yeah, yeah, definitely. A lot of collaboration.
Yes, tons of collaboration with, all walks of life, all different agencies and administrations and subject matter experts. I think, as when you're in school and you're learning who key leaders are in communities, um, a textbook will give you some examples of that. And the textbook is great, but real world experience, it might look different than the textbook. So that has been another huge piece of what I do is not just collaborating with people who we know are working on this, but finding the collaborators that are not necessarily at the table or in the room or even aware that the conversations are happening, wanting to get those voices and those perspectives from people who are, adjacent to the field you're in or adjacent to the topics that you're trying to address and completely removed. There's I always say that public health is, connected to everything. I think every violence, injury prevention type thing out there, pretty much any topic out there, you can draw a path back to a public health topic or initiative.
For sure.
And sometimes it's just, about finding what that path is. But I would consider that a huge part of what I've done at the state, what I've been hired to do at the federal level is kind of help build those pathways and those collaborative relationships.
That's amazing.
Yeah, it's awesome.
What a cool job. Yeah.
Yeah, I think, yeah, and like I said, traffic safety was not on my radar at all. I never thought that I would be so into it.
Yeah.
I landed my state job when I was about 6 months out of
Okay.
graduation from Colorado School of Public Health.
Yep.
So, job search, and I know that varies year to year, different economies, different stuff happening, but some people it happens really quickly and sometimes it doesn't.
Yep.
So, it took about 6-ish months.
Yep.
And I will say, you if your goal is to work in state government or county level or federal, do not give up
Yeah.
on the application process. I can't tell you how many federal jobs I've applied to. And I think I applied to 5 or 6 different jobs at CDPHE before I even got through the process. So
Mhm.
it's really hard. I know it can be
Mhm.
so discouraging when you just keep hearing no after no, but you just need that one yes. And sometimes, the jobs that you're applying for just aren't the right fit, or you don't use the keywords that they're looking for. So that would be my big advice if I could go back
Love
in
that.
time and talk to myself is just keep trying. You will
Yes.
get that yes.
Yes. And
Yeah.
it paid off. You kept trying
Yes.
and look where you are.
Yes.
Yeah, usajobs.gov is a big career board, but they really do have a lot of good resources on how to apply for jobs on their website. So I highly recommend, just follow their advice.
Yes, I agree. Follow them on LinkedIn.
Yeah.
And I would say, like, this was also very generic advice I was given was like, always be networking, expand your network. Which yes, I will still give that advice. But I will say, when you get into a job, and even if it's not your dream job, even if it's just, a stepping stone to the next big thing, network, meet people. You never know who knows somebody else and who can, give you that email address to just talk to somebody. And again, just be willing to approach people just to have a conversation, not necessarily to always be getting something out of it. But I would say that's how I kind of built my public health world was meeting people. And I didn't even, like I said, I didn't even know about a federal job that wasn't on my list when I started with the state, but the more people I met in the job at the state, the more I heard where people, different agencies where people worked, different pathways that they took to get there. And so, I built that for myself, and it takes time. But yeah, I think the generic advice of like building your network is kind of like, okay, well, like how? But
Exactly.
also, yes, build your network.
Yeah, I think sometimes it does feel a bit overwhelming when you hear like advice like that because you're like, I'm new to this
I don't know
profession.
anyone.
Yeah, how do
Yes,
I? And I think we got to think of it more as like just one person at a time. Like it doesn't,
one person at a
but
time.
yeah,
Yeah.
like you all know people in your classes or in your current
Yes.
work. Like that is you're building your network there. Like it doesn't have to
Yes.
be this huge, like
No,
I
you don't
need
need to know like, the president of the CDC. Like
no, yeah,
stay in contact with classmates or with educators. That was how
yep,
I found the state job. One
yeah.
of my educators at Colorado School of Public Health, my evaluation educator who I loved, and she, wrote me a letter of recommendation for the job. She served as a reference, but she was the one who found it and just said, "Hey, check this out. That I think you'd be. This is an entry level job. I think you'd be great for it." Um,
That's
I didn't find it;
awesome.
she found it for me. Yeah, and it worked out. So
Yeah.
yeah, it comes from all corners of your life. So don't discount anything. You never know where you're going to find the next move.
Yeah, totally. Yeah, yeah, yeah. Now that we're kind of on the career advice section, what are there any like journals or conferences or trainings that you would recommend in your career field?
Yeah, so I mean, again, a lot of the ones that I could recommend are going to be more safety
Okay. Yeah,
focused.
that's okay.
But again, as a violence and injury prevention person, one of my favorite networks, and I actually applied to work there at some point, is called the Safe States Alliance. They are a national, I think they're a nonprofit organization, very well organized, but they are a public health nonprofit. They provide resources and platforms and collaborative efforts for public health professionals to come together, specifically in the world of violence and injury prevention. So they have, a traffic safety track. They have sexual violence prevention track. They have nutrition. They have, child infant mortality prevention. They've got, healthy motherhood stuff. Like they've got everything. So if you are a public health professional, and even if you don't know what your interest is, they are a great resource.
Cool.
They are a small team, is the other thing. So very approachable. If you reach out to someone, they're going to get back to you. I'm sure that I don't want to speak for them, but they are great folks. And I'm sure that they would be, if a student reached out to them to just say, hey, can you talk to me about this? Or, even your career at Safe States, I bet they'd be willing to do that. So I will recommend that one highly. So you can sign up as a member. It does cost money to be a member, but you can also just sign up for emails,
Nice.
and be a part of it that way. Um, Another one would definitely be the oh my gosh, what's it called? Rocky Mountain Public Health Training Center.
Yes, we
think
love
I
them. Yes.
Love them. They have so many great trainings on just about anything that you'd want to learn about. But especially, I've really liked their meeting facilitation trainings, or their partnership building trainings, or their health equity trainings have been really wonderful. So that would be another resource I would recommend. And then lastly, I think as far as like staying up to date on emerging public health
Mhm.
topics, or just resources that are out there,
Mhm.
what I have found to be helpful, and I still do this even this far in my career, is I just Google. I just look for different, if there's a topic that I'm interested in, I want to find who's doing work on that, even if it's, local level, national level, it doesn't matter. I just want to know what's being done around this topic. And that can be a super, super niche thing. Um, for example, like what states are working with their tribal partners to address um, young driver safety? Like that's drilling down pretty
Yeah.
specifically.
Yeah.
But you can find, local, not just your state health or your state traffic safety departments, but even the smaller organizations that they fund at the county level or, on the local
Yeah.
level. And
Yeah.
that's where, again, the meat and potatoes is of for me, of what I love is hearing about what's happening on community level. So they're out there, those, they've set up their own websites, or maybe it's on a Google site platform. Sometimes you have to, dig around a little bit in person. Meeting in person could be another thing. But yeah, I would say think of what you're interested in,
Mhm.
start Googling the topic, because you're going to find content out there, and that's going to get you access to things like newsletters, where you can
Yeah.
stay up to date on stuff that's happening with an organization or within a topic, which also tend to include job announcements.
Exactly.
So yes. Yeah. So of course your LinkedIn, stuff like that is going to be helpful. I feel like LinkedIn has become a great resource. When I was in like undergrad, it was still kind of
Yeah.
getting its feet off the ground, and I really didn't use it that much, but I have used it in the past couple years. So that's a great resource. But yeah, find what you're interested in and go towards that, because the opportunities and the topics of discussion, they're going to be there.
Yeah, yeah, definitely. It's such a cool job. Like, I mean, when you think of everyone's driving and, that,
Yeah, everyone's driving a huge chunk of metal,
yeah,
80 miles down the highway, and it does cause significant injuries and fatalities. And there's um, the behavioral health aspect and, community aspect
yeah,
behind prevention around that. Again, I I kind of like fell into this, but I grew to really, really become passionate about it, because I'm so passionate about public health. So I have sort of been on the, I don't know, emerging cusp of linking traffic safety to the world of public health. So when I joined CDPHE, and we were funded through Colorado's DOT to work with them, to work with their grantees to build that gap between traffic safety, traditional traffic safety, and public health. And I started talking to other states. You go to meetings, you go to conferences, and I learned that not a lot of states have it set up that way. A lot of states don't have their public health department, meeting with, let alone working with their Department of Transportation. And so I started learning that that was a very unique relationship, and I kind of but that kind of became my mission was, okay, well, how can I either advise other states or model for other
yeah,
states, to be, collaborating with their other state agencies. And that, the same could be for any other topic. If your passion is housing, affordable housing, is your public health department talking with your Department of Housing?
mhm,
I don't think ours was that much,
yeah,
So
yeah,
it could be said about just about anything. And what's happening in one area of a state or a county, not necessarily happening in other areas. So
that's
the
true.
need is there.
Yeah. Yeah.
Yeah,
I mean, it just kind of brings up this common theme of public health is everywhere.
it's everywhere. It's
Yeah.
everything. Like
Yeah,
I will,
everything.
yeah, I will
Yeah,
like sing that
I
song
know.
forever. Like it's
Yeah,
everything.
I
And
know.
it's easy to become passionate about it, and it's
Yeah,
easy to become passionate about one niche thing in public health.
yeah, for sure.
Or you can, keep it broad. You
Yep.
can go many different, your skills are applicable in many different areas. So
Yes, and
yeah,
that's what I love about the career field is if you get burnt out with a topic, all right, you can go to another one, or you want to
change.
switch up your skills, go to a different one. Like there's so
Yeah.
many opportunities in public health that you're not, pigeonholed or glued to like one path.
No, no. And I've never felt that way. I think when I was a student, and I think this is common, especially in undergrad, you're what, 19, 18, starting out. It feels like, and it is, I don't want to invalidate it. It is a big decision to
Yeah.
pick your major and what it is you're going to study. And but for me, my personal experience, I had so much anxiety around that. I think I changed my major like 10 different times
Mhm.
because I felt like, if I make the wrong decision, it's going to set me up down the wrong path and I'm never going to be able to turn around. Not true. You can always pivot. You can always turn around. You can always backtrack. Um, I will use my amazing husband as an example. He was a massage therapist for a
Yeah.
long time and then decided to go back to school. And we're in our 30s. He's just now finishing up his undergrad degree at Metro, and he's applying to PhD programs. So your path is, you're not falling behind. It's not a race. You go at the pace that makes sense for you and you go down the path that makes the most sense at that time. If I hadn't really followed that advice for myself, I think I would have fulfilled my parents' dreams of me becoming a surgeon,
Ah,
which,
yeah.
yes, I carried those dreams for a long time and then realized that maybe we didn't share the same the same dream.
Yeah.
And I'm so thankful I listened to my heart on that and my head,
Mhm.
because that just wasn't the right path for me. This for sure was the right path for me, and I think I knew that, but was scared to pivot for a long time. So, but
Mhm.
even so, I ended up where I am, and it's been right so far. So,
And that's that's a really common, how we get into our careers. I mean, I changed
stressful.
my major 4 times. If you would have told me I was going to be a career coach, I would have been like, what?
Right?
It's,
Yeah, yeah,
yeah, it's such good advice that like, I think sometimes we stress too much on what we're going to be when we get older, like
yeah.
just
I think
enjoy the
so.
process and
Yeah, and you know what? You're gonna be older anyway, so you
yeah,
might as well just do the thing that you want to do. Like,
that,
time's not gonna stop, so like just do the thing.
yeah, and
Who
sometimes
cares if you're in your 30s or 50s or
yeah,
you're 19 and you don't know?
yeah,
It's fine.
yeah. Definitely. And I love that you're working in a topic that you didn't even know existed. And
No, like I never put, traffic safety in term like, yeah, I think a lot of people, you just don't think about it. You don't think about how uh buckling up, like I don't even remember putting my seatbelt on yesterday when I drove my car, but I know I did.
oh yeah,
It's just
just
automatic.
like
But that is public health, that's
mhm,
behavioral health, that's part of community health, that's part of young driver safety. There's entire community voices and opinions about legislation around seatbelt use and if it should be like a primary law to buckle up and what that means for communities of color and they're just that one topic of seatbelt use
yeah,
has policy branches to it, community branches to it, behavioral health components,
yeah,
um,
yeah, definitely.
everything.
Yeah. Yeah.
So
No,
yeah.
it's so true. Um, what would you say are some of the challenges that you see in your current role or public health in general, whatever, it's okay if it's with, what you're working in.
Sure. I mean, when you start a new job, I think everything's challenging.
Yeah. Yeah.
But yes, I think I guess on a more general scale, public health, like I said, you tend to wear a lot of hats. I I have found that to be true no matter what,
Mhm.
working in from nonprofit to state health to federal, you wear a lot of hats. Your job title might be this, but you are also helping to analyze data. You are helping to lead meetings. You are advising on media campaigns. You're doing whatever it is that needs to be done. Not to say that you don't have your specific path in your specific job, and but if you like living outside the box and not kind of being told to stay in your box, public health's great for that, because again, everything is public health. So if
True.
you can draw the connection to it, you can argue that it's something you can work on. Of course, that depending on where you work and who your supervisor is and things like that, but generally speaking,
Mhm.
if you have something that you're passionate about, or you feel like, hey, this is connected and is important and we need to be working on it, if the pathway doesn't exist, like, be the first one to make it.
Yeah.
And so I would say that that is rewarding and challenging, because I am someone who works really well with defined pathways, defined boundaries. I like working outside the box, but it's very comfortable to stay in a box and say, no, this is where I go.
Yeah.
That's not my responsibility. Um, but it is challenging. So you got to kind of push yourself if that's outside your comfort zone, like it is for me. It is challenging, but it can be very rewarding.
Yeah.
I would say, let's see, challenges on more of a smaller scale. I think, like, it's no, especially over the last couple years, it's definitely not a secret that public health has been, I think, really amped up in media, in everyday life. Like, I think the pandemic really had people maybe who hadn't thought about public health before paying attention to public
I
health. And
know.
so
Yeah.
burnout is a real thing, in
Absolutely.
any job, but in public health, it's been a thing. um, I think a lot of our epidemiologists were really burnt out by the time, COVID was
Yeah.
in its third year. So I would say burnout is a challenge, both because you can experience it yourself, you can feel the effects of it from your team being burnt out. And again, there is like the blessing of the world of public health, where if you are feeling burnt out, you can generally take a step back into, something a little less intense, or you can change topics altogether. If you're like one of my roles at the state was with the child fatality prevention team. um, and so for 5.5 years, I would sit in on meetings and we would talk about, child fatality prevention methods. And that sometimes involved talking about different cases involving infant and child mortality and
Yeah.
specific examples. And that really, really wore on me. For, I respect people who, people in the field who can do that every single day, because it is a lot emotionally. And so for me, that was one motivation for leaving the state job that I had, was, I want to take a step back, because this is so emotionally heavy to be thinking about this, talking about this all the time. I'm ready to shift my focus to something a little less, emotionally challenging. So that's
Yeah.
just my experience. Again, I
Yeah.
have friends at the state who still do it every single day, and they love it because it's such important work. And but it is hard, and
Very hard. Mhm.
you've got to be resilient, I think, would be the other challenge is,
Yeah. No, that's it.
resiliency isn't built overnight. So
Yeah. Yeah. Yeah.
um,
No, this
yeah,
is
but
all really good advice
yeah,
because it
yeah,
has
find your
been.
people and find ways for real self-care, whatever that looks like for you. And because public health is, I always say, public health workers, I think they wear their hearts on their sleeve. I think public health is heart work for a lot of us. We are just so passionate about it. It's part of, why some public health jobs are very low paying, and we're still here doing it because we love it, because it matters and it's important to us. So don't let that deter you. there are ways to step back or, take care of yourself, take breaks if you need to. But yeah, resiliency, it's a
Mhm.
number one skill, I think, in public health.
Absolutely. All right, so my last question.
Okay.
I'm curious as a mom and
Okay.
as someone who's going to have teen drivers one day,
Hmm.
where do you see the future or what innovations are coming down the line on like protecting drivers? And,
Yeah.
like, I always thought as a kid we're going to have flying cars, when I get older. And
Right. Yeah.
uh,
TBD on the flying
yes.
cars. Yeah.
Yeah. But are
I
you
love that
seeing
question.
some innovations in traffic safety and all of that?
Well, yes. I guess where I turn my attention to, I mean, yes, there's definitely innovations happening. I think cars are a lot safer than they used to be. Cars are also a lot bigger than they used to be. So, on one hand, they're a lot safer. They have a lot more safety features inside of them. On the other hand, we have gigantic, pickup trucks that are
Mhm.
3 times the size that they used to be.
Yeah.
And those cause a lot of, I won't get into it, but you can't see anything around around those things. You could put
Yeah.
a whole, class of children in front of those and the driver won't be able to see all of them. So they're huge, and
Yeah.
that has its own uh, implications. But yes, definitely, as time goes on, there's more safety features. I think driving safety has become a much more hot topic. It's definitely, I mean, I think it's a sexy topic, but uh,
Yeah.
right.
I do too.
But it is getting a lot more attention.
Good. Good.
Specifically speaking to young people, young drivers, young passengers. Um, I love this question, and I get so excited to talk about this because when I ask or when I talk to young people about driving safety
Yeah.
and what's important to them, when I was 16, I couldn't wait to get my license.
Good.
When I talk to 16-year-olds today, a lot, and I don't want to generalize, this is just the youth that I've talked to, but a lot of them say, I don't really care if I get my license. I want public transit to be better. I want a safe
Mm.
neighborhood to ride my bike to
Yeah.
school or to
Yeah.
work. I want to be able to walk home at night without feeling afraid.
Yeah.
Um, I want, my friend who uses a wheelchair to be able to go down the sidewalk without it just ending
Yeah.
into
Yeah.
a highway or something. So, what I the term I we'd use for that is called built environment. So your environment that is, contributing to the experiences that you're having. So an example I like to use is nobody, it's nice that you see these neighborhoods with really nice pathways, bike paths. That don't really go anywhere. And that's nice to have, to just go on a bike ride. But built environment, talks about active transportation, active mobility. Nobody's trying to ride their bike to the big box store. Nobody's going to Costco on foot or to Walmart. Like people want to be able to go to work. They want to be able to go to the doctor. They want to be able to go to school through, different modes of transportation. And so that is kind of the hot topic that
Cool.
yeah, a lot of young people are focusing on
I like that.
is public transit and mobility justice, being able to having the right to feel safe and be safe in their communities and have access to reliable transportation. And so we're very car centric nation. It's really hard to not have a car in the US and get to work or get to school or get to the doctor. Um, and so Europe is always used as kind of like the shining example of, how they do it. But we don't have the same infrastructure. We built all these roads and highways. We rely on our cars. So what are we going to do about it?
Yeah.
Um, and that's the sound of young people right now is they are saying, I don't like it. It's not good enough for us. So I'm really excited to see where um, youth in the future take the world of traffic safety, and public health professionals getting their degrees in the next couple of years, if you don't know what you want to do. And traffic safety sounds like a sexy topic, like it does to me. Yeah, I think public health is really looking to shape up the world of traffic safety, and public health belongs there.
Oh,
So don't
yeah.
let anybody tell you that it doesn't.
Oh, it absolutely does. Absolutely. Yeah. Wow. Well, thank you so much. I think you
Yes.
have the coolest job,
Oh,
and
thank you. Me
thank
too. I
you for
really love it.
the amazing work you're doing for the state of Colorado and all of the programming and traffic safety. I'm sure you saved a ton of lives you don't even know about,
Yeah, I think
which
I have to believe I did.
public health, right? And we're so
Public
behind the
health.
scenes.
Yeah.
Yeah, but
Yes.
thank you so much for sharing today.
Thank you. Thank you for having me.
Yeah. All right.